This patient education video is one in a series brought to you by the American Academy of Allergy, Asthma, and Immunology, and sponsored through an unrestricted educational grant from UCB Pharma.
A lot of people try to avoid stinging insects, and with good reason, particularly if they're allergic to them. If you are allergic to stinging insects, it's important to know what these insects look like, where they live, and how to avoid them. We'll take a look at some of these insects and talk about ways you can avoid getting stung, and if you do get stung, what steps you should take. My guest for this program is Buzz. Don't worry though, he won't sting you. He'll just drop by from time to help us out. Each year, many people are stung by some form of stinging insect, and of those people, quite a few will experience a reaction to those stings. Most stings come from 5 types of insects: yellow jackets, honeybees, fire ants, paper wasps, and hornets. Hornets and yellow jackets are found all around the country. Hornets are black or brown with orange or yellow markings, and about 3/4 to 1 inch long. Yellow jackets are black with yellow markings and about 1/2 to 3/4 inch long. It may be difficult to tell the difference between the two unless you know where they live and in what type of home. If you see a large football-shaped nest made out of paper material, rotted wood, and leaves, it's probably a hornet's nest. These nests usually sit on tree branches, in shrubbery, or on the gables of buildings. Most yellow jackets live in nests made out of paper material located underground and in the walls of frame buildings and in tight corners between cracks in buildings and rock walls. The paper wasp is about the size of a nickel, but is thinner than a hornet and a yellow jacket. Its back legs are very long. You can tell paper wasps from other stinging insects by their color. They're usually black, brown, or red, with only a few yellow markings on their body. They make their nests out of a paper-like material with a comb of many small circle-shaped cells or openings pointing toward the ground. Paper wasps generally build their nests in hidden areas, such as behind shutters on a house and in shrubs and wood piles. The 4th type of stinging insect is the honeybee. The honeybee is very common throughout the U.S. In addition to the wild population, there is also a large domesticated population, raised in man-made hives to produce honey. Honeybees have rounded, hairy bodies with dark brown coloring and yellow markings. Their abdomens are striped, and they're about 1/2 inch long. When they sting, they usually leave their barbed stinger in their victim, which causes the bee to die. Honeybees are fairly docile, stinging only when provoked. However, there is a hybrid of a honeybee that is more aggressive. It's an Africanized honeybee, often referred to as killer bees. It is found mostly in the southwestern portions of the U.S. and in South America. While much of the Africanized honeybee's reputation has been hyped by movies and the news, it is a more aggressive bee and tends to sting in swarms. Wild honeybees live in colonies, building nests in hollow trees or in the cavities of buildings. Hives are constructed of beeswax and consist of repeating combs called a honeycomb. Domesticated honeybees live in man-made hives. All these nests have one thing in common. They're very busy in the late summer and early fall. This is also the time you're most likely to be stung by these insects. The last stinging insect we'll talk about is the fire ant. While these ants are fairly small, at about 1/8 of an inch in length, it's important to avoid them. They're not afraid to sting, and they are very aggressive. Found in the south, fire ants are reddish-brown. Their homes look like big mounds, usually reaching 18 inches in height and stretching underground extensively. In each of these mounds, up to 250,000 ants live and work together. So, if you happen upon one of these mounds, it's a very good idea to avoid it. Do not disturb their active home. Fire ants and the hornets, bees, and wasps mentioned earlier usually have a reason for stinging. They will sting if you disturb their home, and they can become upset if you swat at them when they're flying around you. Some of these insects can sting you repeatedly, so if you get stung, leave the area immediately to avoid continued stinging. Fire ants sting by attaching themselves to you and injecting their venom into your skin. They usually sting repeatedly and in a circular pattern. Keep in mind that the venom from any of these stings can cause you to react in a number of ways. Usually a sting causes swelling and redness at the site. It might itch or burn a little, but the discomfort generally goes away in a couple of hours. Occasionally, these local reactions can grow larger and last as long as 2 weeks. These more serious reactions may require medical treatment. Allergic reactions can affect parts of your body that aren't necessarily near the sting site. Though not common, the most serious allergic reaction to a sting is called anaphylaxis. Anaphylactic reactions include itching, hives, a swollen face, tongue, or throat, breathing problems, nausea, dizziness, or even loss of consciousness. If you or a person you're with start to develop these symptoms after being stung by an insect, get medical help immediately. Anaphylaxis is a medical emergency. Early intervention is the key to minimizing its potentially deadly symptoms. For more information on anaphylaxis, see the anaphylaxis video program within this series. You may experience other symptoms not mentioned in this program. Therefore, it is very important to talk to your allergist and let him or her know about all of your symptoms. After that, it's time to take action to prevent those insects from stinging you. Uh-oh, you've caught me. Okay, I'll admit it, I have a sweet tooth. But I'm not alone because many stinging insects also have a sweet tooth. With this in mind, there are some simple things that you can do to avoid attracting stinging insects. When outdoors, keep your food and drinks covered. Also, keep garbage tightly covered or at least far away from your activities. Don't walk around outside barefoot, as stinging insects may be in the grass. Stinging insects are attracted to the strong color and scent of flowers, so avoid wearing bright colors and strong perfumes when outside. Insects sting when their homes are disturbed, so it's a good idea to have all nests professionally destroyed or removed from areas around your house. These measures will help you avoid attracting stinging insects, but some will persist. If you find a wasp or hornet flying around you, avoid swatting at it, as this may only anger it and cause it to sting you. Many times the insect will just fly away on its own. If even after following all these suggestions, an insect stings you, you can take action to reduce some of the symptoms. If the stinger is still in your skin, you were stung by a bee. Don't grab the stinger. You'll inject more venom into your skin. Instead, immediately scrape the stinger away from your skin with your fingernail or credit card. How you treat your reaction will depend on how many times you were stung and the physical reactions you're having to the sting. If you know you're not allergic to insect stings, simply clean and apply ice to the site to help reduce swelling and ease the pain. The pain and swelling should go away within a couple of hours. If you start to feel itchy, dizzy, short of breath, flushed and nauseous, get medical help immediately. These are signs of anaphylaxis, and the sooner you get help, the better off you'll be. Of course, you may have reactions that fall somewhere between mild and serious. So make sure you tell your allergist how you physically reacted when you were stung. It could be an indication of a new allergy to stinging insects. For those people who have had a serious reaction to an insect sting, there is a way to prevent future serious reactions. It's more of a long-term vaccination program called immunotherapy. Studies show that this technique is almost 100% effective in preventing and reducing future insect sting reactions. Before undergoing treatment, however, a person must be venom tested to determine if an allergy is present and to what type of insect the patient is allergic. For instance, it is possible to be allergic to a wasp sting, but not a bee sting. Venom testing works like this. A small amount of various insects' venom is injected into your skin in increasing dose stages. If you're sensitive to a particular venom, a welt or hive will appear after about 10 minutes. The stage at which you react tells the doctor how allergic you are to that particular venom. This information allows the doctor to set up a venom immunotherapy plan for you. Venom immunotherapy works like this. Your allergist injects a series of gradually increasing doses of insect venom into your body to slowly build up your resistance to the venom. With continuous treatment for 3 to 5 years, most patients stop reacting to stings completely. Furthermore, many patients can stop the shots after about 3 years and continue without fear of insect sting reactions. Because venom immunotherapy takes several months before your body starts to become immune to an insect sting, your doctor may have you carry an injectable form of epinephrine. This self-administered shot helps to protect you from serious reactions if you get stung by an insect during the initial stages of your venom shots. But it is not a replacement for further medical treatment. You should still have someone take you to the emergency room if you are stung by an insect. Also, during this time, your doctor may recommend wearing a medical alert bracelet or necklace, which is a tag that contains information about you and your medical condition. In case of an emergency, a medic could look at the tag and quickly get information about your condition. It's designed to save your life when someone else can't help you or tell the medical personnel about your condition. It's important to talk to your allergist about any reactions that you've had after being stung by an insect, and be sure to follow your doctor's instructions regarding treatment. Also, if you have a medical alert tag, wear it at all times, and take your injectable epinephrine with you wherever you go. Knowing how to avoid and manage your reactions to stinging insects brings you one step closer to enjoying all your favorite outdoor activities. And Buzz and I both agree. Isn't that what it's all about?
For more information, please call the American Academy of Allergy, Asthma, and Immunology at 1-800-822-2762. Or visit our website at www.aaai.org.